To be able to diagnose energy status of the patient and his disease, it is important to take a thorough history and also do a detailed examination. Even if the patient has had a recent illness or a musculoskeletal pain, for which intensive energy balancing is not necessary, we need to ask certain questions. After all, we are treating a person with local pain or recent disease caused by an injury or a climatic factor. This person could still have a problem with sleep, with feeling cold all the time, with constipation or nervous diarrhea, and this needs to be treated for the patient to feel a sense of well-being. Remember that we are treating an individual with their own particular history and problems that may or may not be immediately related to the symptom with which they came to us. A good treatment is when we treat the problem and treat the person. Too many therapists treat only isolated regions of the patient's body because they fail to see that this isolated problem is in a unique person's body. We take the problem out of the patient's body, and then the problem does not even exist for real anymore. The author here feels very strongly about this way of treating only the problem the patient comes with for treatment, and therefore he will be presenting to us some cases to substantiate his point. Clinical example, we have a 49-year-old male with shoulder pain. So a man came with pain in the right shoulder, radiating to the arm. He worked on a carousel, although the manual job was not particularly heavy. He had been having pain on and off for more than a year, but this time it had lasted over 2 weeks. He had taken time off work and was on anti-inflammatory medication, which he has been taking at more than the prescribed dose, and had been having stomach pains because of the medication. On observation, he was rather hunched forward in his upper back, though he could straighten himself. Although a tall man, he had been working for many years in a bent posture and seemed to hunch most of the time. His thoracic back seemed to hunch up until the C7 vertebral prominence, and then it seemed to form a rather acute angle with his neck. So this curvature of thoracic spine is very common. Sometimes it is a fixed kyphosis, and sometimes it is just bad posture. In some patients, mostly women, there is also a large edematous lump over the C7 vertebral prominence. You might want to try to palpate that if you have it, okay, which makes the symptoms more constant. So these people keep their head and gaze directed downwards most of the time, only looking up when necessary. When they do look up or when they raise their arm, the acute angle at C6 to 7 worsens, and this will cause pressure on the nerves that supply the shoulder and arm, hence the radiating pain. They have constant pressure on their trapezius muscles. There is also weakening, sometimes even atrophy in the shoulder and deltoid muscles, which means that every time they use their arms, they are straining the neck directly. If we cannot work on the problem of posture, then there would be no permanent solution to the shoulder pain and weakness of the arms. Why do they hunch? Is it that they have low working areas? Or are they depressed? Or do they have a low tension on the due meridian that runs along the vertebra, the yang of which should keep our back straight? Whatever the reason, you should be able to help patients like the man in the example given. First, we should make them aware of the problem. We could strengthen the yang of the vertebral column with a moxa cigar. We can treat depression with the tonification of the yin and yang of the heart and lung, the two organs in the upper warmer. Use the points lung 1, bladder 13, ren 14, bladder 15, and pericardium 6. So these are the back shu and front mu points of the heart and lung, and the area distal point of the thorax. In the above patient, the moxa technique of due meridian was used, and local points on the lateral and dorsal sides of the shoulder were used with hot needles. The pain reduced with one treatment and mobility improved. 6 more sessions were given to stabilize the effect, and the patient's wife now gives him moxa on the due meridian once a fortnight So this is like every 2 weeks to prevent further problems. It is now over 3 years since he had the treatment, and he is still working and has no pain in his shoulder and arm. But he continues to receive moxa treatment because the patient would always go back to the doctor who happens to be the author of our source. No? So we are sure that if only the shoulder pain was treated, he would still have improved for a short period, but then the symptoms would have returned. So after a few courses of treatment, the therapy would have ceased to work. So this is the importance of treating not only the problem, but the patient as a whole. So this is the real holistic treatment.